I'll ask you if you want to get information for your So, is there a preference in terms of who wants to talk about, who wants to go first on the issue of what's the impact here in Georgia?
1 minute. What do you want to do? Gotta let it play out.
Oh yeah, by all means.
Do you, okay, I mean, I can talk about how many people are going to be losing health insurance, and then I also had some information on, you know, how uninsured women are already affected by being denied life-saving preventative care. So if I can work that in all together.
Okay, so we'll sort of divide this, the first 15 minutes or the first 12 minutes.
Okay.
So it will be Medicaid, the Medicaid expansion issue in general.
Okay.
Second part.
Stay around. You're on.
Okay. Second part will be more about Oral Monday, January 13th, why you're involved.
I'll put that in there then.
Okay. And then we have to close out about 2 minutes out. Okay, so same thing. Try to get you all in. Diane. Okay.
The labor forum is brought to you by your Teamsters friends and neighbors. The Teamsters have over a century of experience in enriching and protecting the rights of workers nationwide.
Sharon, can you turn it up just a little? Can you turn the volume up in here just a little?
With 1.4 million members, 30% of whom are women, Teamsters can be found in almost every major industry.
So just smile, okay? You know, this is the moment.
Keep America
It's the truth.
He knows who's watching.
Want more
I have some
information?
idea.
www.teamster.org.
We plant the food, we drive the cab, we load the ship, we run the lab, we build the bridges, we fly the plane, we do the work. This is our day, we do the work. We do the work. We do the work. This is our day. We tie the place.
Good afternoon and welcome to the Labor Forum. My name is Diane Mathowitz. You are listening to WRFG 89.3 FM in Atlanta. I'm a retired auto worker and I want to welcome you to this half-hour program that happens every Tuesday and Wednesday on the station WRFG 89.3 FM. You also can listen to us on your computer at www.wrfg.org, where you also will find the information for an app for your mobile device. And for those of you who have the interest, you can actually watch myself and my guests here as we conduct the program. The Labor Forum now has a YouTube channel, Labor Forum WRFG on YouTube. So I want to announce again, as always, that the opinions that are expressed on this program may not necessarily be those of the Board of Directors, staff, or volunteers here at WRFG. Today's program is one of great importance and interest. Starting tomorrow, January 1st, it will be a happy new year for many millions of people across the country who are going to be able to afford health care under expanded Medicaid. Unfortunately, for many people, it's not going to be so happy because they still will be without health insurance. They still will be without the ability to get the necessary health care they need because they live in states such as here in Georgia, where the governors have refused to sign on to the expanded Medicaid program, which is part of the Affordable Care Act. So I want to welcome to the Labor Forum's second to the last program of the year, because we'll be on again tomorrow, New Year's Day. I'd like to introduce Kimberly Brooks, who's sitting right next to me.
Hello, everyone.
And on the far end there is Jackie Rodriguez.
Hi, Diane.
Great. So Jackie is the president, state president of Georgia Now. Kimberly is the chapter leader of Parents Across America, and she works at Grady Hospital, which is one of the health institutions that are going to be devastated, frankly, by the failure of the political leadership of this state to expand Medicaid. So I want to go into that first, and just in case there's someone who's listening who doesn't quite understand what this means, expanding Medicaid, expanding Medicaid. It applies to a certain economic sector of people, people in certain situations, and many people who are listening to this program may not fall in that category, and so they may be feeling so let's talk about what does it mean for Georgia not to have expanded Medicaid? Who's impacted, who's not? You want to start?
Go first?
Sure. Well, I mean, what it really means for Georgia is that the people who already were in the most desperate situations are going to be pushed into an even more desperate situation. The people who are not going to get coverage under expanded Medicaid are the people in the lowest socioeconomic status who already may have had trouble handling their health care costs. You know, as you mentioned, many people here in Georgia are going to be impacted. In fact, over 600,000 Georgians are not going to have access to health care. They're going to be denied that by Governor Deal's refusal to accept Medicaid. As Diane mentioned, you know, Georgia is one of several states that has declined to expand Medicaid. There are 22 other states that have also declined, and they are all governed by Republican governors. And I think that that is really a greater comment on the travesty of this situation, that Governor Deal is going to literally let people in Georgia die because he would rather stick to a political platform than to do what's best for the people of Georgia.
Let me pursue this a little further. My understanding is that this expanded coverage affects in large part single adults who make below, I think it's something like 11,000.
Right, 11,000 and 15,000. Most importantly, I think it's about 50% below the federal poverty rate. And what happens is it applies to most of the individuals that fit that socioeconomic status that have children. So the Medicaid expansion, currently individuals that have children and families, the planness of federal Affordable Health Care Act is designed as a preventive measure. So you have a lot of Georgians that are uninsured, that have children and families, and they're not able to afford health care because they don't fall within a certain category. So the expansion of Medicaid allows those individuals that have families and children to be able to have access to affordable health care. Now, there are some individuals, those without children, that will not have access to the health care, but the thing about it is the Affordable Health Care Act is incremental. We can start here, and 600,000 individuals right now currently are affected by this Health Care Act. More importantly, the federal government is substantially supporting this by budgetly helping us with 100% expansion for the first 3 years of the cost, or whatever it's going to cost for us for Nathan Deal to sign for this ego and his party identity aside and say, hey, we need this. And after 3 years, it's 95%, and after 2020, it's probably going to be like 90%. So with me being an employee of Grady Health System, when you think about healthcare services, Grady Healthcare provides services to people that doesn't have medical insurance. So what happens is we will help them regardless of whether they have insurance or not. But without the Medicare expansion, what will happen is we will have to pay that bill. We will have to provide medical insurance to these individuals that are eligible and that need this service. So it's more important with what's right and what's wrong and what's fair and what's unfair. So I just think it's really stubborn of the governor to not support this bill, because it is definitely going to help the citizens of Georgia. And it's what's, as a governor, it is a responsibility and it's his duty to make sure that you take care of the constituency. Those are the 600,000 people. I don't see how this could have a backlash of any type of negative effect in regards to a budget or deficit that will incur. And it'll help prevent a lot of services that if they did not have this healthcare before, you wouldn't have to go back and have all of these other additional services and referrals for other services and specialty needs that you would normally have to have. So definitely, when Jackie here gave those numbers, and she was speaking about the 640,000, that seems like a small number to some people, but when you're a mother and you have children, you have family, you just don't make enough money, that healthcare matters. When you can go, you can get dental care, you can pay for prenatal care, and it relieves the small business owners that don't have a lot of profit, that pay these individuals that can give them insurance that they can afford, so that now they have an option. And of course, you may not have as many call-ins, and you may not have as many things that you would have had, because the government has now, took a step and been more proactive than reactive in decisions being made in our legislation. So that I definitely see. I've done a little work on Medicaid expansion. I'm an advocate for education, and I have not really seen where this could be, have some type of effect, a negative effect in regards to our budget. The federal government is supporting this by the Affordable Health Care Act, and I just really can't understand why, this is a big issue, why this is such a large problem when it has so many benefits.
I wanted to ask Jackie, because you're president of the National Organization for Women, and certainly the issue of health care for women is a critical issue, as is the health care for everybody, but there are a lot of ramifications to when certainly a mother or a provider, and I was wondering whether you had any more additional information about how the loss or the failure of Governor Deal to do this will have broader social impacts because of women who don't get the care they need.
Yeah, absolutely. I mean, it has been well established that women who do not have access to health insurance do not get the preventative care and screening that is really life-saving and necessary. Before this Medicaid expansion kicks in and all these people become ineligible, prior to that, 1 in 5 women were already uninsured. And we know that when women don't have insurance, when women are uninsured, only 36% of them are likely to get a mammogram. When they're uninsured, only 62% are likely to get a pap smear. However, when we give these women insurance, the overwhelming majority of them seek out this vital preventative care. When they have insurance, 74% of women get mammograms, 83% get their regular pap smears, 54% fill their prescriptions. When we're talking about actually going to the doctor and paying out of your pocket and finally getting the prescriptions for the money you need, these women are going home and they're unable to fill these prescriptions for themselves and for their children. And that's a very real impact on society. And that's why this is a women's issue. It affects women, it affects their family, and it affects society.
So we will be right back with our two guests. You've been listening, and for those of you who are watching, you're watching Jackie Rodriguez, who's president of the Georgia National Organization for Women, and Kimberly Brooks, who is with Parents Across America. We'll be back right after this short message. Hold on. You love WRFG? I mean, really love WRFG. The music, the information. And how about
your point about Grady and the unpaid bills and financial ramifications is really an important point, I think, because if
Wait.
And we're back. This is Diane Mathewitz, and we're back on the Labor Forum with our two guests, and we're talking about the importance tomorrow, January 1st, when millions of people across the country are going to be able to have expanded Medicaid health insurance coverage, but not here in Georgia. And that leads us to why the two sisters are here, and that is that they are both part of the Moral Monday Georgia Coalition. This is a group of people, along with many others across the state, who have been working to convince Governor Deal of the error of his ways, and that in fact Georgians demand him to sign on to the expanded Medicaid. And so I'm going to ask both of them a little bit about the Moral Monday Coalition. I'll start first. Why did you or your organization decide to join? And then we'll go into the January 13th first activity. You want to start, Jeff?
Sure. Well, I was invited to attend the Moral Monday meetings by Move On Gwinnett. So I attended the first meeting, and I've decided to join. As I stated before, I really feel that this is a women's issue. It is something that has a larger impact to society, and as more importantly than women, as voters in Georgia, we have a responsibility to stand up and say, this is wrong, I have a voice, I am going to use it. Coming into 2004, we need to make changes that are going to protect the people of Georgia and not the political interests of our governor. So that's why Moral Monday has become important to me, and I know that Medicaid expansion is a priority issue to National Organization for Women, and Georgia now has been looking to build alliances within the community, and this is really something that fits right in with our philosophy that all people are entitled to equality, and by denying this section of people access to Medicare, the governor is telling the state that the poor and needy of Georgia do not matter to him.
For anyone who is not clear about, Moral Monday started as a movement in North Carolina and it attracted national attention last year when they held huge demonstrations every successive Monday during the North Carolina legislature, which was engaged in a very reactionary agenda of pushing back on any number of pieces of legislation that impacted everything from women's reproductive health, education, voting rights, workers' rights. It was a across the board kind of really backlash against people's interests. And one of the reasons they got so much attention is that hundreds of people committed civil disobedience each successive Monday until finally almost close to 1,000 people had been arrested. So folks here in Georgia sort of saw what had happened in North Carolina, feeling that the Georgia legislature is on the same track of backpedaling against rights and benefits that people should have. So may I ask you, Kimberly, why parents across America or you decided to join the Moral Monday Coalition?
Hold on, I'll tell you. I became a member of a network called MAPS, which is Metro Atlanta Public Schools. And it's a wonderful network. And I was always been a person I've engaged in canvassing a lot of political things, and I just wanted to see action. I really need to see something being done. So I was invited to a meeting, and I was sold. Because Moral Monday is not about a party identification. It's not necessarily about, one organization or one movement. It's a catalyst towards a lot of other social justice events, such as education, right now Medicaid expansion, possibly criminal justice, that individual citizens, organizations can get together and we can require that our governors and the legislators do what they're supposed to do. And that's the purpose of Moral Monday, because moral is to do what's morally right and what's fair for its constituency. So Moral Monday, to me right now, is Medicaid expansion. When I was listening to the individual who spoke on yesterday, NAACP president here, he was very clear about it taking a long time for them to get to this point, since 2004, before they were actually able to mobilize and make the changes in North Carolina. So for me, with Parents Across America, it's a national organization, and as I've advocated for education here, it's a great challenge. When we have a group of organizations that understand and appreciate the importance of legislation and legislatures and why we have to come together, and it's for the greater good, it's fulfilling for me, and it's just awesome. It's really awesome because it's a lot of hard work involved, but it's about the morals and values and things that hold this great country together, those rights and liberties that our Constitution promised to us, to everyone, regardless of race, gender, age, social, economical statuses, whatever that may be. And this organization could be an excellent organization to start a movement to require that our individuals that we elect, that you do what you're supposed to do. And that's fair, and that's what they're elected for. So that's what brought me to MAPS Cafe and Parents Across America. They're just awesome organizations. Moral Monday, I'm just excited to see what this is going to lead to, the effect that it's going to have, and coming together and just seeing everyone together, because it's really great.
So let's talk a little bit. There have been meetings for a number of months now, and the Georgia General Assembly opens on January 13th, and that is the first kind of big public event that this Moral Monday Coalition is planning and organizing. Jackie, do you want to start with saying what it is that's going to happen on January 13th?
Yeah, absolutely. First and foremost, as the first day of the legislative session, this is the time to really let our voices be heard. And Moral Monday has put together a really terrific day full of opportunities to not only meet your representative, but to get educated and to get out on the street and let your voices be heard. And I definitely would urge anybody who feels passionately about this issue, or even who just wants to learn more about how this is going to affect your fellow citizens of Georgia, to definitely think about attending the January 13th rally.
Do you have the time, the schedule?
I do. From 4 to 6 p.m. is going to be the rally on the steps at the Capitol, but there are events beginning at 10 a.m. You can find more information by going onto Facebook. You can check out Moral Monday GA. Or if you are not on social media, you can also contact them at moralmondayga@gmail.com. You can get a full list of the schedule.
So I know that in North Carolina, it was every consecutive Monday during the entire session. And again, for folks, you can Google the Moral Monday North Carolina, and you will see all of the pictures and all the information about what they did there. And it is an incredibly inspiring movement, and they are continuing as well this year in North Carolina. Are there plans beyond January 13th for Moral Monday, Georgia?
There are plans beyond January 13th. The idea of the rally is to start getting people educated and to let our voices be heard. And after that, if I'm not mistaken, don't quote me on it, you can visit the website. So the action movement, when legislation starts to pass in July, there will be another meeting that they're scheduled to have. Visit the website. But more importantly, we're gathering people together on January 13th. It's very important that they show up, because education and addressing those issues is what we're trying to do right now. And that's the most important thing with the Georgians here. They need to know and they need to understand what's going on with their government and legislation, because it's important and it's going to affect them. So we encourage everyone just to participate to any of the events if you can. And for the most part, it's very important. It may not affect you, but your community and everyone else, and it's a part of just being a part of this great city of Atlanta, in Georgia. So we want to hold our governor accountable for those actions that hold him accountable for those actions and things that he needs to do. So that's what we're going to do.
Maybe I could ask one more question about the Moral Monday Coalition. Could either of you name some of the other organizations that our listeners might be familiar with that are participating?
Yes, well, I think Kim touched on this, that, part of the really great thing about Moral Monday is that it's a combination of both individuals and organizations that might not necessarily share the same views on everything, but we have come together and we're united under this common cause of equality and justice for the people in Georgia. So, I came as an individual and as a member of the National Organization for Women, but I would like to see the Georgia Now chapter get involved as a co-sponsor. There were gentlemen from the Nation of Islam. There were representatives from the NAACP. Move On Gwinnett was there. Retired teachers across America. There was such a vast array of every social welfare, political, educational coalition that you could possibly think of, has interested members that are coming out for Moral Monday, because it really is about transcending the small differences that we might have and come together and unite under the common causes that need our attention here in Georgia.
Let me ask, as this half hour winds down and people are getting ready to do whatever they do on New Year's Eve, whereas we're here talking about what is going to impact people in 2014. And so one of the things the Moral Monday Coalition, as both of you have mentioned, is really trying to be the beginning of a movement. And I think for many people who've not really experienced a movement, that is different than a one-time demonstration. It is different than even a year or so of hard work. A movement, frankly, is something that changes history, that really changes the social conditions of first maybe a group of people, but that goes on to actually change the whole society. And so this idea of expanding Medicaid, many of the people at the coalition meetings are people who are in fact fought for single-payer health care. And so that this whole question of these insurance companies is another question, but that, again, regardless of what people's position is about that, they have all come together to say that this is a program, it is a law, the Affordable Care Act is a law, and that the citizens and people of Georgia should not be denied the benefits of that law. We have just a few minutes left. I want to have you repeat one more time the Moral Monday information, but then if you would, if you have information about your individual organizations, you can go ahead and let people know about those as well.
Okay, I have the information for Moral Monday. Anybody who is interested, there are a full day of events down at the Capitol. It's going to begin at 10 a.m. on the state Capitol steps. It's going to be followed by a lunch. There's going to be workshops running from 1 to 3 p.m. And then the rally on the steps is going to begin at 4 o'clock, and it's expected to run through about 6 p.m.
Okay, do you want to go ahead and let people know if they're interested in now?
As I mentioned, I'm the president of Georgia National Organization for Women. We have recently convened the Georgia State Chapter. Our formation just happened recently in November. We're going to be having our first annual meeting January 25th at 11 a.m. in the event room at the Philip Rush Center on DeKalb Avenue in Atlanta. And at that meeting is really important because it's not only our membership kickoff, but it's also going to be the meeting where we are deciding what action and issues the group is going to be focusing on for the year. And I would really like to see Medicaid expansion on that list. And the only way that it's going to happen is if we get interested parties in that are willing to help us work for this really vital cause here in Georgia.
And Kimberly, is Parents Across America your chapter leader? Do you have meetings that you want to let our listeners know about?
We currently don't have any meetings here scheduled in the city of Atlanta. Parents Across America is a national organization that advocates for children. And the Medicaid expansion, while we can talk about things like the mental health issue in children, is one of the major things that parents have to experience with their children in the educational system. You can visit the website, Parents Across America, national organization.org, if you have time to further get information on the events that we're having here. We've had some marches in the city of Chicago and Louisiana. We've actually advocated in the change in legislation in regards to choice and work vouchers. So thank you very much for having us here, Diane. I really appreciate this first opportunity that I've had to be on air. So I thank you very much for that.
Okay, you wanted to say something real fast?
I'm sorry, I just wanted to add really quickly for everybody to check us out on Facebook at Georgia Now for updates on information. And if you're not on social media, you can email us at info@georgia-now.org. And I hope to see everybody on the 25th. Thank you very much for having us.
Okay, so we'll look forward to seeing everybody as well, January 13th, and you can tune in again tomorrow if you're not a football fan, and watch and listen to the Labor Forum, or you can squeeze us in. Tomorrow we're going to be talking about the upcoming People's Tribute to Nelson Mandela. One of the things that occurred after Nelson Mandela died is that we heard lots of voices extol him. And it's important for people to appreciate and know the groundwork that was done here in Atlanta as part of the broad international anti-apartheid movement that helped free Nelson Mandela and also helped tear down the apartheid system. This is Diane Mathowitz thanking you so very much for listening today. And again, Happy New Year. And we will be back next year, 2014, for another year of resistance, struggle, information, and inspiration. Bye-bye.
I'm sorry. My